Hello everyone, I'm Alison Morrison-Chetler, President of the University of Lynchburg. And today I'm going to be meeting with leaders from across campus who have been integrally involved in making sure that our campus is safe and ready to receive our students back for our spring semester. And so today I have with me Provost Jablonski, who has led our COVID task force, and we're going to talk a little bit about what the spring semester is going to look like. So thanks very much for all that you've been doing, Alison. It's been an incredible time since March, right? And we want to obviously learn a lot from what happened in the fall semester. And we had a pretty successful fall semester. So do you want to talk a little bit about some of the lessons that we learned and how we're going to transfer that to the spring semester?
Certainly. So we did have a successful fall semester. It looked unlike any other semester that we've ever had. But academically, students did well. We had a mixture of hybrid classes, online as well as some in person. The instructors were really diligent in working with their students. And I won't say that it was all perfect, but we did learn some lessons. And some of those were that in-class transmission of the COVID-19 virus was not a factor. So everybody did a great job wearing masks, doing social distancing, and limiting the time that they were together in the classroom. The instructors learned a lot about technology in terms of using video conference software, Google Meet, using Jamboard, which is one add-on that allows students to draw on a document together simultaneously with the instructor. Learned online lab exercises, discussion boards, all kinds of technology that they then worked with the students to try to duplicate the in-class experience. So it was successful from many angles, and we're taking those lessons forward with us into the spring.
That's great. And you know, a lot of the services to students were also very innovative in their ideas of moving from the face-to-face environment to the online environment. I know the library did a fabulous job in reaching out to students and gaining access to materials. Tell us about some of the other units that really stepped forward and did some really fabulous things to support our student success.
Right. So the Academic Achievement Center is crucial for our student success. And they did orientation online this summer. And then they continued to work with their students in one-on-one meetings online. Did trainings and accommodations, all of the regular things that the AAC does, they were able to shift to a safe way. The Wilmer Writing Center did their tutorials online, and it was interesting because we used a new set of software called Writing Center Online that allowed for making appointments, and then the tutors could work with the students individually in 30-minute slots. That was a great implementation. The Career and Professionalism Center actually gained, I think, more traction with students and alums because they were able to meet people where they were digitally, virtually, were able to have videos of their sessions, and I think they got probably more student traffic than they did in their offices in a regular semester. So all of those units really did a great job working in a new environment.
Mm-hmm. I think that's one of the things that people might have felt that was missing from their academic experience, but in fact the resources that we have upped their game and allowed more access for students. It's not that students didn't have access to resources, they were there and they just needed to take advantage of them, which
exactly.
I think is great. And so how that's transferring to the spring, you know, you mentioned the lack of transmission of the virus when in the classroom. And so we did online, but we also did hybrid and face-to-face. Is that what we're planning to do for the spring?
Exactly. So the academic schedule doesn't look a whole lot different from the fall. We have about 40% of our classes that are completely online, and then the remainder are hybrid. Most of our in-person classes are experiential classes that you can't really do online, like labs or activity courses, one-credit courses. And so, yeah, that looks very much like it did in the fall.
Mm-hmm. So one of the other things I think people are a little concerned about is, how is the interaction between the students and the faculty and the staff? Did you feel that went well in the fall, and how do you see that being even better in the spring?
Well, I think that we've learned some lessons about what students need in terms of faculty interaction. We have pushed to have more synchronous online classes so that students have a particular time and a place virtually to go for class and feel maybe a little bit more connection to their instructors. We have had digital office hours or student hours so that faculty can meet with students to discuss their progress in a class or maybe some personal concerns or advising concerns. And faculty and students have been really excited about those opportunities. I did have a suggestion that I will follow up on, that maybe some faculty could have outside office hours on a nice day on the Dell, which we all enjoy. So I think that that's also a good idea.
That's great. That really is good. I know there's been some conversation, particularly in the fall, but definitely there's questions for the spring. Pass-fail or A through F grades?
Standard A through F grades in the spring. Mm-hmm.
Okay. There's also been concern, I know, with were the grades affected in the fall compared to previous years, and I know that I looked at the data and I was very pleased that in fact that was not the case. Do you want to talk a little bit more about that?
Yeah, we did an analysis of the breakdown of grades for the undergraduate classes, and they were very, very similar to what we saw in the fall of 2019. So that led us to believe that while some students may have struggled individually, the undergraduate student body did great.
Fabulous. That's great. I know that we have been very much concerned about what's happening in the community in terms of COVID numbers. We've done a great job on campus, and I think it's our faculty and our staff, but particularly our students, have done a fabulous job in keeping us safe. How do you think that has, again, affected the sort of community on campus, inside the classroom and outside?
Well, I think there's some concern and worry because the Lynchburg community has had a high number of virus cases. But we are a unique community on campus because we have been so compliant with mask usage and social distancing. I think we're doing a better job than the city of Lynchburg is, honestly. And so that has kept our numbers low. I feel like faculty and staff and students who are centered around our campus are going to be safe because we have a really robust public health plan that has been praised by the Virginia Department of Health as well as Centra, who is our local hospital system. And so we're rooted in data and in science and looking at how we can keep folks healthy. So if students stay on campus and limit their exposure to the greater community, I think we'll all be safer.
And how have faculty and staff been working to help students who have to go into quarantine or being isolated because they've tested positive?
So we have a lot of faculty who have been working with students who were in quarantine in the fall, and I fully expect the same situation in the spring. Some of that looked like a faculty member recording a lecture and then making the recording available to a student later. Some of it was just a little bit of independent study work with the student. Some professors were actually able to live capture their lecture and have the students tune in from their room or home while they were lecturing. So we've been able to do that pretty effectively for the faculty. And again, that was a learning curve for all of us. And so I have to praise the faculty for working with their students in that way.
I'm just so impressed with what the faculty have done.
Oh, me too.
And pivoting in March to go from face-to-face, which is what we love to be able to do, to going online, was a learning for everybody, and our faculty just did amazing jobs. How have we been keeping the face-to-face environments safe when we've been having face-to-face classes?
So in face-to-face situations, We're limiting the number of individuals in the room at one time based on social distancing, and so we actually measured each of the rooms to figure out how many desks would fit, so on and so forth. And then we're doing a good job cleaning surfaces. So when the students and the instructor come in, they take advantage of cleaning wipes and sprays, wipe down their individual surfaces, and then classrooms are arrested for a short time in between, so that we're mitigating the risk as much as we can, and of course wearing masks as well.
I think what I'm hearing and have seen over the last few months is that everybody has stepped forward to do a fabulous job in making sure that the Lynchburg experience is what it could be and should be, or as close to the face-to-face environment that we've had in the past. Now that the weather's a little cooler, outdoors has been a little different.
Mm-hmm.
How do you see that changing in the spring?
That's a good question. Well, I think that we're going to have to make some changes in terms of, people's willingness to be outside. So I'll leave that for my colleagues in residence life to deal with some of that. Academically, I don't know that it's going to change much, except we'll have more space once we hit March and April and the weather turns nice. Now we will have to deal with inclement weather and the cold. So bring your hoodies.
I love it. Well, one thing that I know that you all did was to purchase, 52 or almost 60 more of our character changing red chairs here. I just, I love to see that at the end of the last semester when I was walking across the Dell to see faculty out there with students and having large circles, socially distanced, all of that good stuff, and how much the students enjoyed that. So what I really saw was the students love being together, they love being with their faculty, and that even in these unprecedented times, they were having a great experience.
I think so. That's what I hear. I'm going to be teaching this spring for the first time since we've been online, and so it's going to be a learning curve for me as well, but we'll give it the old college try to get the Lynchburg experience.
I love it. Well, I just want to thank you again for your leadership. You've been leading the COVID task force and juggling all the balls of that, as well as leading the academic side of the campus really, really well. So deeply appreciate what you and your team have done. And we know that going into the spring, it's going to be even better. And now we have Dr. Aaron Smith with us. He is the VP for Student Development and Dean of Students. And we're going to talk a little bit today about, how did it go last semester, Dr. Smith? And how do you think we learned from last semester and how we're going to apply that to this coming spring?
Yeah, absolutely. I think last semester went well. I mean, we were able to finish the semester, so I think that's a huge plus in and of itself. Our students remained safe, and it was very different. I mean, we had hybrid and online and a lot of virtual programming and virtual experiences, but we were able to learn from really kind of what we did in the summer. We piloted some things in the summer, and then we did some things also in the fall, and we modified some things throughout the semester as well to make sure that our students are receiving the best experience that they can receive as a Hornet. So I thought the semester went well, and I'm looking forward to an even better semester during the spring.
That's great. I've been so proud of our students because they really have done everything that we've asked them to do.
Yep.
And having a really good health plan, we're going to talk a little bit about that later on, but having that health plan and the students doing what we asked them to do, I think the Hornet pride came out really, really well.
Absolutely. Absolutely. I just want to jump in and say I am 100% with you. I felt like I was putting a bit of pressure on our students in terms of, hey, if you want to be here this semester, then you've got some things that you need to do, and I thought they rose to the occasion. And again, we stayed safe. We had some ups and downs for sure, but we stayed safe, and we were able to finish out the semester strong.
Yeah, that's great. So we're both wearing masks, and again, it was a joy to walk around campus and see everybody adhering to the mask policy and doing the right thing.
Yeah.
How did the students respond initially to having to wear masks, and how did they, continue to do that?
Sure. I would say slowly. They responded slowly. I remember having some groups come in during the summer, and many of our students were wearing masks. The 6-foot rule was kind of a bit of we had to continue to reinforce that as well. And masks can be uncomfortable. They're hard to breathe in. You got to keep doing this as well. But overall, I thought our students responded well, and they understood the importance of the mask, and that's why I was so thankful to have such an excellent health plan, not just what was coming out of the government, not just what was coming out of the state, but here locally and on our campus as well. Just talking about the importance of wearing the mask, and our students, it was uncomfortable for some early, but they got it and they did it, and it helped keep us safe.
That's great. Well, I'm always grateful for the students, supporting the safety of the institution, and they really stepped forward to do that. So let's talk a little bit about residence halls.
Yeah.
And we were successful in containing the virus, even though we have obviously students in residence halls and housing situations around and the perimeter of campus.
Yeah.
How did we manage the whole single bathrooms for people who had to go into isolation, and how did we manage quarantine? Because I think that was our true success, right?
Yeah, well, it was, and really hats off to our housekeeping staff as well in terms of keeping, especially some of those community bathrooms, safe. They were cleaned with more regularity than they had been cleaned in the past. So in our traditional residence halls that have community bathrooms, and our housekeeping staff and our RAs, they did a phenomenal job of just making sure that they're monitoring and making sure that they are cleaned with that specific regularity. And it was no secret, we had a number of students that ended up being in quarantine or in isolation as well. So I mean, we contact traced, and fortunately for us, I mean, the new residence hall, which is Westover Hall, that was just built, and we have a lot of Southside residences, which are houses, and so we were able to quarantine and isolate a number of our students in those locations that had a singular bathroom that met the CDC guidelines as well, and were able to keep our students safe. So throughout the semester, and we certainly started in one place and ended somewhere else in terms of all of the care that was needed for each of the students who might have been in that situation, from being able to deliver meals, for talking about taking trash out, talking about getting toiletries, talking about making sure you have enough clothes there as well, talking about their mental health. I mean, from the beginning of the summer till the end of the semester, we came a long way in terms of receiving feedback about what was it that maybe you needed while you were in quarantine or isolation that maybe we provided, maybe we didn't, what worked well, what didn't, and we took that feedback and we implemented it, and so our quarantine isolation situation certainly got stronger throughout the year.
Mm-hmm. That's good. And I know I had the privilege of phoning quite a few of the students who were in isolation and quarantine, and they felt that they were really being well looked after.
Yeah.
And particularly around dining.
Yes.
So tell me a little bit about how we manage dining.
Absolutely, and that was one that I didn't mention at all. Our dining service, catering service staff, they were phenomenal. So obviously with COVID, we restricted guests on campus, so we really restricted a lot of the events that we would have had on campus in general. So our catering staff, really, they ended up being busy, I would argue 24/7, and making sure that our students had hot meals that were delivered in those quarantine isolation places, because those students weren't allowed to leave. When you're in quarantine or isolation, you have to stay in that spot for the designated number of days. And our dining service staff did a phenomenal job of ensuring that meals were delivered to our students, and not just meals, not just hot meals either, but even to their preference. So obviously we have students that have different diets, like our catering staff they were phenomenal in terms of making sure that they listened to the students' needs who were in that particular space on the weekends, at night. I mean, it was awesome to see so many groups working together, because that was also a housing thing as well. And again, our physical plant, making sure the places were clean and ready to go. And again, we had some bumps in the roads on some of that stuff, but I was really happy to see, especially where we ended in terms of a well-oiled machine. I'm a little hesitant to use that term, but I mean, it improved quite a bit from the beginning of the semester.
Right. Yeah. Well, again, our environmental services folks, our dining services, they're the frontline people,
Yes.
along, of course, with our health center and all the things that they've done.
Absolutely.
So I'm really, really proud of how we dealt with all of that. You mentioned a little bit earlier about guests on campus, or parents coming to campus.
Yep.
How did we deal with that?
Yeah, well, especially, well, as you know, we had a couple different alert levels when we started. In alert level 1, when we came to campus, we went to an alert level 2, and then we were in a modified alert level 2 as well. And in that modified alert level 2, which we really spent the rest of our semester in, we had no external guests inside of our residence halls. So when parents wanted to come to campus to visit their students, we really asked that they not come into the residence halls, because again, we just wanted to try to keep the students as safe as possible. If there was an emergency need for a parent to come in, we could work with campus safety and security for that. But in general, we did not allow external guests inside of our residence halls for the duration of the semester, really from kind of September onward.
And then there's the reverse situation. How are we dealing with really asking the students not to go into the community? Because, as you know, we've got a fairly significant increase in the community, which is nothing like the rest of the state or, in fact, the rest of the country, but it's still high. How did we manage that in spring, and in the fall rather, and how are we going to manage that in the spring?
Yeah, well, in the fall and in the spring, we really encourage students not to go out if they don't have to, venturing away from campus. And I know that there are opportunities for students to leave, but especially if they have to leave, again, we encourage them not to. But if they have to leave, to make sure that they're continuing to maintain 6 feet, make sure they're wearing their masks, make sure they're sanitizing their hands as well. Because what we don't want to have happen is a student leaves campus, and is not as careful away from campus, and they come back, and then we have a spread of the virus on our campus. So we didn't restrict travel, but we strongly encouraged our students to stay on campus, which then means, we have to make sure that we're doing our part to make sure that we're providing as many resources and activities and the food and everything else that's necessary so our students can stay on campus safely.
Yeah. And you mentioned also earlier mental health, and you've alluded to that, having activities that the students can get involved in so that they want to stay on campus.
Yes.
Enough things happening on campus that they want to stay on campus. Can you just talk a little bit about the mental health the situations that occurred in the fall, and how we've sort of ramped up maybe what we're doing to ensure that our students are well taken care of in the spring?
Absolutely. So that was one of the big feedback pieces I think we got, especially early on from our quarantine and isolated students. And we found out essentially that it can be a traumatic experience. And so while we have a care team in place who really takes a look at our students who might be in distress or might be in crisis as well, our counseling center did just start this semester telecounseling as well. So the students who were in those isolation and quarantine rooms, they were able to have telecounseling opportunities as well. We also created a couple of systems where we had buddy systems so that folks were checking on our students. You had mentioned yourself that you had made some phone calls to our students in isolation and quarantine. And we also have it's not a new position, but it was a refilled position from the fall, who will also continue checking up on our students who are in isolation and quarantine as well. And we really encourage that because it can be a lonely place. And many of our students have their phones and their laptops and things of that nature, but still, when you're by yourself for several days, it can be a lonely place. And so we're absolutely committed to making sure that our students are taken care of there. And so we will continue to reach out to make sure the students in quarantine and isolation are in a good place.
You mentioned the buddy system.
Yeah.
Tell me what that sounds like, and are we ramping that up for the spring?
Yeah, absolutely. So we have, in our Center for Community Engagement, we have students who like to volunteer. One of the things that we noticed in the fall is that some students had more support than others in terms of being in a quarantine or isolation space, which is fine. Sometimes that's just the way it is. But what we wanted to try to make sure is that every student received like a high level of touch. And so when we reach out and we talk to students in terms of, we send them a survey and say, would you be interested in like having a quarantine buddy? And they can either select maybe a friend of theirs or quarantine buddy from our Center for Community Engagement, that they can kind of watch after them and kind of get them necessary items that they might not have or might have forgotten, or just to check on them in general. So that certainly will be ramped up, and I think it will be very helpful.
Yeah, I think so too. We want our students to be engaged on campus. We've talked a little bit about that, but what about social gatherings? What are we saying they can do? What are we saying they can't do?
Sure.
And what are the triggers to changing those?
Yeah. So we absolutely want our students to be social, but we want them first and foremost to be safe while they're being social. So at the moment, the governor's guidance is that social gatherings of 10 people or less are not permitted. And one of the things that I thought we did really well in the fall, we made sure that any kind of engagement event had guidelines that were followed. Where it's 6 feet, you have obviously masks, and even when it was, say, a comedian or a band that happened to come to campus or something like that, because our students still valued those in-person opportunities, that each of those were done safely. So really the 10-person limit is our trigger. Inside our residence halls, it's a 1-to-1 ratio. That means you can only have an on-campus guest at a 1-to-1 ratio. So you can be in your house and you can have one guest, and that's up to 10 people. In terms of the social activity, like the social activity that kind of the campus sponsors as well, we'll just make sure that each of those programs and activities are done in a very safe way. I'll give you another example about that. Our outdoor leadership programs, they had a number of trips that went off campus. But again, under very, very strict guidelines in terms of the safety in the van, the types of masks they're wearing, what all of the protocol is, was very detailed and very intentional to make sure that our students are safe, even if they're going away from campus for a school-sponsored event.
We do want them to have fun.
Absolutely.
We want them to be safe, but we want them to have fun, which is great. A lot of our spirit is around athletics. And so I know that we've had a couple of swim meets and we've had a basketball game, so we've started the season.
Yeah.
We have taken the whole season, fall and spring, and compressed them into just the spring.
Yep.
What's that looking like?
Oh, it's looking awesome, I think. I think it's pretty awesome. Actually, I just came from down there. Athletics, I was watching our lacrosse team practice, and I went into Turner Gymnasium as well. And you can tell the coaches are pumped up. I mean, they're super excited. You can tell the athletes are pumped up too. Actually, I was talking to one, and she said, I can't wait for classes to start so I can get in more of a routine as well, even though she had been here for a little bit. But, this will be an unprecedented semester in terms of all the sports really are happening in one semester. But you opened up your question with the thought process of spirit. And I think that athletics does a tremendous job of helping our school spirit as well. So everything is packed in one semester, so that means there's going to be something to do every night. And I hope that even though there are going to be some different guidelines, I hope that we have as many folks cheering them on as possible, because they help in terms of making sure that our campus is bright.
Right. So spectators at games, what's that look like?
Well, not for basketball, not for indoor sports. So there won't be any spectators at our basketball games, but those games will be streamed as well, and as many games will be streamed as possible. We will have opportunities to have some spectators outside, which will be nice. So we'll make sure that we have opportunities for some games and some prizes and things of that nature, so that we can make sure that we're providing as much support for those student athletes as possible. So no spectators inside, unfortunately, but there are many other ways to make sure that you're supporting the team.
Because I think we are streaming over our YouTube channel, right?
Absolutely.
So everybody, wherever they are, can tune in.
Yes, and so that should be a lot of fun, because Joe Hutzler and his team, Lynchburg Hornet Sports Network, they have continued to do a great job, and I know personally from working with Joe and the team, and so a lot more people are going to get to see their work, up close and personal, and get to see the athletes perform at their best. So yes, you are correct. You'll be able to see it wherever you are, on your phone, on your tablet, on your laptop or computer.
Yeah. I know Bob and I watched some of the basketball game on our television. So we had it, you know, large and right there in our living room, and it was fabulous.
Yes.
It really was fabulous. Just to make sure that everybody knows, how are we making sure that our athletes are safe? What are we doing in terms of testing?
Yeah.
Can you tell us a little bit more about that?
Absolutely. So our athletes in high contact sports, so our highest contact sport is basketball. Those athletes are being tested 3 times a week. All of our athletes are being tested as well. So they're actually, the Old Dominion Athletic Conference came up with a few tiers of the sports and kind of their level of contact, I suppose. And so our basketball friends are getting tested 3 times a week. The next level of sports, they're getting tested once per week, and 25% of their students are going to be randomly tested as well. And then the lowest tier, they're going to be tested monthly as well, and randomly tested as well. So all of our student athletes are going to be tested and tested frequently to make sure that we don't have an outbreak of the virus, because teams are close, and so they're typically not just social, but they're close in proximity, and so we want to make sure that they're tested early and often, and they were tested on the way in as well upon entry, so that they can be as clean as possible, for lack of a better term.
Right. And we're asking all of our students to be tested before they come onto campus.
Yes.
Tell us a little bit more about that.
Yeah, so during the first semester, we did not require tests, although we did provide towards the end of semester testing opportunities for our students who were asymptomatic. And we certainly provided testing for students who were symptomatic in our health center as well during the fall semester. This semester, however, upon entry, all of our students have to show that they were able to get a negative test, and they have to submit that into their health portal for their health records in our student health center. With that said, not only do they have to do that in order to kind of re-enter our campus, we're also going to be doing random testing for our student body. So we will, first few weeks, we're going to have our health department come in and help us do some randomized testing for our students. And then if we see, we're going to take a look at the data, because we're just a data-driven institution. We'll take a look at the data and see if we need to do some targeted testing in particular places if necessary. But our students, yes, our general student population can also be expected to be tested this semester.
That's great. Well, I just want to conclude with a great deal of thanks to all of student development, because you really do support our student health and well-being in so many different ways. So your teams are doing a fabulous job, and thank you, Aaron, because your leadership is really showing through here by everything that's happening to support and make sure that our students are safe and well. So thanks very much, and I appreciate all the information that you've shared with us today.
Absolutely. Thank you.
Thank you. So now we have Lisa Geyer, who's the director of our health center, here with us. And Lisa, I just want to thank you and your team for everything that you've done to keep us safe and well on campus. So I really just can't tell you how much the whole campus appreciates the work that you've been doing. Last fall was an interesting fall, and I just want to ask you, what did we learn from the fall? What did we put in place in the fall that's going to help us in the spring?
Yes, so last fall was very challenging. We did learn a lot. We started out, if you remember, in August, just trying to scramble for resources and get enough testing kits and supplies and everything to the health center so that we could focus on testing. And so we realized that we needed to do as much testing as possible. And we've really ramped up the testing for the spring semester, and we have more access to rapid tests and PCR tests, which is nice. So we learned the importance of testing. We learned how to quarantine and isolate students, and we learned our capacity to be able to do that on campus was a little more than what we had originally thought. And thankfully, our students were not really sick. There were some students that were pretty sick, but nobody was hospitalized, which was a blessing. We learned a lot, and we've changed some things and put some important things in place, I think, for the spring.
So one of those important things is that students are coming in with a test.
Yes.
And we learned pretty quickly that that would be something that would help us from the get-go be safe. Because in the fall we did see that spike, 10, 14 days into the semester, that allowed us to change our criteria a little bit. So tell us a little bit, why was it important to have the students tested before they come to campus?
Yeah, so with more access to testing, we felt like we could ask students to test before they come. We want to try to get them tested 1 to 3 days before they come to campus, but we'll take a test as far as 7 days out. So and that has been helpful. We had some athletes that have returned early and have found several tested positive before they came. So we're hoping that mandatory test prior to arrival will help screen out some positive COVID, asymptomatic positive COVID students. And hopefully our student population will come back virus-free, and that's our goal with that mandatory testing prior to arrival.
We did talk about as clean, people are returning as clean as possible.
Yes.
And you mentioned antibody and rapid testing. Could you tell us a little bit about what the rapid test is and the PCR test?
Yes, so the antigen test is the rapid test. So it's a point of care test that's usually done in a health center. It takes about 15 minutes to get those results back. The PCR test is the long test, and so that usually takes 2 to 4, maybe more days to get those results. The PCR test is a much more accurate test than the antigen test, but we will accept either the antigen, which is the rapid, or the PCR test for the pre-arrival testing. We're not accepting an antibody test because we don't know what that really tells us. And a positive antibody test may not reflect a disease-free state or a viral-free state. So we're asking that people submit an antigen or PCR test. Now, if they've tested positive for COVID within the last 90 days, they do not have to submit. We ask them to submit that positive test result to us, but they don't have to retest. The CDC guidelines right now state that if a person has had COVID within the last 90 days, we're fairly confident that they have antibodies and will not be reinfected with COVID, as long as it's been within 90 days.
That's good. I really appreciate that clarity on the different types of tests, because I think it's confusing for some people, and to know that we are recording the positives and recording the tests, I think is really reassuring, not only for the students but for the parents as well, which is great. You talked about obviously the testing, and could you tell us a little bit about what we're planning to do in the spring around testing that might be a little different? And I was talking to Dr. Smith earlier on, and we were talking about the athletes and the testing that we're doing to the athletes. So could you give us a little summary of what we're doing?
Right. Well, and like I said, fortunately, we have a lot more access to testing. So we can, in the health center, we can do the rapid antigen testing, and we can also do the PCR testing. So any student that has any concerns about an exposure, or if they're ill, we want them to come to the health center so that we can test them. We are also doing serial antigen testing, which is the rapid test on the athletes. So part of their requirement to play a sport is that they have to be tested multiple times. So we're helping with the testing the athletes. And then in addition to that, we've partnered with the Department of Health, and they are supplying us with PCR tests, the long test. And we are going to do randomized testing weekly for at least the first couple of weeks on a portion of our student population, residential students. and I think that will help. What we're trying to do with that is screen out again the asymptomatic carriers of the virus. So that those randomized tests are for people that do not have symptoms. So I think that will help. And then once we get those results, we might do some targeted testing. For instance, if we find that we have a few students that test positive in one particular dorm, we might test more in that particular dorm. Mm-hmm. So I think the testing will really help guide us to identify virus or disease earlier.
Mm-hmm. I think that's great that we have the resources to be able to do that, because I know it was difficult at the beginning, but now there seems to be a lot more around to be able to test our students. And so tell me a little bit about why is it important that we all wear masks?
Well, the masks are important because that is part of our what we call mitigation strategies. So there are, as I said, asymptomatic carriers of the virus, so the mask helps to protect people. Both, it's very important for anybody that is sick to wear a mask, but you don't know if you've got the virus. If you might not know, and so that's why we require everybody to wear a mask. And that's part of the CDC recommendations. Important mitigation strategies are mask, social distancing, hand washing, cleaning your surfaces and that kind of thing. So you cannot stress enough the importance of those mitigation strategies.
Mm-hmm. So where are we spreading the virus amongst our students, for example? It doesn't seem to be in the classroom. We pretty well have no evidence at all that the spread is happening in the classroom. So what's happening?
Right, so the Student Health Center worked with the Department of Health, but we did a lot of the case investigation and the contact tracing for the campus. And what we found was that it was social gatherings, in the dorms, in the houses, that's where the virus was spreading. We did not find that it was spreading in the classroom or in the dining areas, and we really feel like that's because we stress the importance of the mask and social distancing in those areas. And it's going to be important when students return to really limit those social gatherings, because when you have events in your house or your dorm, and you have multiple people there, that's where we saw the virus spread.
Mm-hmm. And we want to keep the campus, residential. We want students to be on campus, and they want to be on campus, and I hear the parents want them to be on campus as well. So in talking with students that I've reached out to through our phone exercise to just reconnect, particularly our first year students, back to campus, they're ready to come back, and they're willing to do what we need to do. So this alert level 2 that we've talked about, what are the triggers to change alert level 2 or even to go to alert level 3?
If we see that we have a significant amount of spread of the virus on campus, if our caseload or our case numbers increase, then we might consider changing to alert level 3. Or if we have too many students in quarantine or isolation, that kind of thing. So we really keep a track of those numbers and of our resources. And the task force meets regularly, and we're constantly reviewing certain criteria to make sure that we still can operate at the level we're operating.
Mm-hmm. And you mentioned contact tracing. How are we doing that? And that's a huge burden on the health center to be able to do all of that. But is everything managing well, and are we doing well there?
We developed some systems last fall that really helped us a lot. We have an electronic medical record that has been updated and now has an area that we can use for case investigation and contact tracing. So that's going to be helpful. But the nurses do that, both those things. So we call the students and we identify their contacts, and then we call the contacts, and we try to do as much education as we can over the phone with them.
That's good. And you mentioned earlier on, in the fall particularly, we thought we had capacity at this level, but actually we found out we had far greater capacity than was originally designated. So what were the characteristics that changed there that allowed us to basically continue with a higher capacity of ability to have our quarantined and our isolated students remain on campus and continue with the business of the campus?
Mm-hmm. So initially we thought that everybody had to quarantine separately. Well, what we found out from the health department is if somebody had the same exposure from the same person and in the same time period, they could quarantine together. And if they had a separate bathroom that they could use, then a group of students can quarantine together. So that really helped us, and it helped the students too, so that they didn't all have to quarantine separately. They could quarantine in their suite or their house or their group. So that was nice. So that's what changed.
Okay. And I think that was really helpful for the mental health of the students as well, to take them out of their environment and put them somewhere else for a 10 or 14 day time period was pretty disruptive to their schedules, but also their communication. So to be able to be with the people that they've been with since the start of the semester probably helped them that way as well.
Right. And can I just talk a little bit about the change in the quarantine?
Sure.
So last fall, the guideline was that if somebody had a contact with a person who was positive for COVID, they had to quarantine for 14 days from date of last exposure. In December, the Department of Health and the CDC changed that recommendation. So 14 days is still the recommended time period. We know that after 14 days, there is no risk for somebody to spread the virus or get the infection. So, but the CDC realized that 14 days was a pretty long time to quarantine, and they were not getting good compliance with that. And so they said that it is acceptable to reduce the quarantine to either a 7 or 10 day period with some other criteria. So as a task force in a university, what we have chosen to do is to the quarantine period will be a 10-day quarantine from the date of last exposure. So we've reduced it from 14 to 10 days, but that person has to have a negative test on or after day 5. So that will help. Now we have to realize that we're going to be giving those people certain instructions to help keep the community safe from that period they're out until the full 14 days. But that we are changing that for the spring.
Okay, again, that's going to be really helpful in just controlling everything. I like the idea of the test so that they're absolutely sure that they're able to get back into the classrooms and do the things that they need to do, so, which is really great. I want to go back a little bit to the levels that we've put in place. Can you talk a little bit about those, just so that we're clear on why, for instance, we went from a level 2 to a modified level 2 last fall, and what are we going to do for the spring?
So last fall, in the beginning of the fall, we did have a spike in cases, and we really didn't know how far that spike was going to go up. And so what we did was we went online for a couple of weeks until we determined that we had control of viral spread, and then we went back to the hybrid model. So what we're going to do this spring is start out at a level 2, which is operating the same way we were at the end of last semester. So some in class, some hybrid, some online. Dining services are, people can dine in or they can take it out, so that's level 2. If we see that cases are ramping up, then we might again revert back to online classes and take out only dining services, that kind of thing.
Okay. So we know what the trigger points are to be able to do that. But again, because of all the testing that we're doing, the hope is that we'll be able to catch things before they get to a spike level.
Yes.
Yeah. What's your advice in terms of, I'm going to get tested before I come to campus. How do I upload my information so that we know as an institution that that test has been done?
And students need to go to their student health portal, and it's lynchburg.studenthealthportal.com. And there's a form on there for the pre-arrival COVID testing, and they can upload their test on their portal.
Okay, great, thank you. We know that our environmental services folks, our housekeepers, have done an amazing job in keeping us clean and healthy. What protocols would you say to people, just to reiterate, keep yourself safe, do these things? So what should what should we all be doing when we come to campus?
Well, what we would like to focus on is trying to keep students here on campus, because the other thing that we saw in the health center was people would travel home and then they would come back and they would be sick. And so traveling off, once we get to campus, and if we can kind of keep our community closed, then we're going to reduce the risk of having the virus on campus. So if students could avoid traveling off campus as much as possible, avoid large gatherings, wear your mask, wash your hands. In the classroom, we'd like you to clean the surfaces of the desk, between classes and things like that.
Mm-hmm. We talked a lot about students that are on campus. What about our commuter students? What is your recommendation to make sure that our commuter students are successful?
Well, the same thing, the same recommendations, really. I mean, they need to follow the same rules as everyone else. And our commuters, I must say, the Lynchburg community is having a spike in cases right now, but our commuters are very good about notifying the health center of when they've been tested. And a lot of them are tested off campus. But they really did follow through and follow the rules and notify us so that we could work with them as far as when it was safe for them to return.
That's great. Because they're such a great part of our community, and we want to make sure that they're safe as well and not bringing it onto campus.
Mm-hmm.
And you mentioned a little bit about being tested on campus.
Mm-hmm.
We also know that some students last semester went to get tested off campus.
Right.
What's the information flow when that happens, if a student does decide to go off campus and get tested?
And that is very important, because if a student goes off campus, because most of them go and get a test because either they're sick or they've had a contact with somebody that they know had COVID. And in both those situations, they really need to isolate until they get the results of the test. So when a student gets tested off campus, we really need them to notify the health center or security if we're not open, so that we can, give them the right instructions about isolation until we get the results back.
So my concern, Lisa, is that students might come and say, well, I'm not feeling too good, but I don't want to go into quarantine. I certainly don't want to be isolated, so I'm not going to say anything.
Mm-hmm.
What's your advice?
Well, and that is a real problem, not only on our campus, but out in the community. But it really is important for us to do the right thing. And in this case, the right thing to do is not an easy thing to do. But people need to protect themselves, but to protect other people. We know that this virus can be very dangerous in certain people, and we don't know who all those people are. So it's just important for people to do the hard thing, but do the right thing, and follow through with the testing and the isolation and quarantine recommendations.
Yeah. We all want to be on campus. We all want everybody to be safe, and it is a hard thing to do. So your advice is well taken. Let's all do the right thing. Let's all take care of each other, and then we'll continue to have a residential campus experience that is really going to help us all be successful. So I really appreciate it. Is there anything that we haven't mentioned that you would like to for people to hear from you?
The only thing is, I think the students last fall did a great job. I mean, this was difficult for them. It was difficult for everybody on our campus that works here. But I really do think that the students and all the faculty, staff, employees worked so hard, and we were really pleased that we could get through last fall. And we're really hoping that the changes that we put in place this spring will make us successful again.
That's great. So we're very excited that the vaccine is coming, and I wanted to find out from you exactly where we are with the possibility of us getting a vaccine, and what protocols we're putting in place, and what your thoughts are about having a vaccine here on campus.
Yes, well, we are going to encourage vaccination, and we are looking at all of our avenues to get people vaccinated. And I know the health department is working hard along with Central Health to vaccinate people within our community. So what I would tell people right now, and this is changing daily, is if you have access to a vaccine, take it. They are working to have our pharmacies, CVS, Walgreens, provide the vaccination. Central Health is providing the vaccination, the health department, and we are also hoping to be a vaccination site and be able to vaccinate our students and employees and staff. We don't know when that will be, but we hope it will be in the near future.
Mm-hmm. So the good thing is that we've got everything in place. If we do hear that we are getting the vaccine at the University of Lynchburg, we're ready to do the right thing.
Right.
Thank you to you and your team, the whole campus, for what we're doing. But you all have done 24 hours a day, 7 days a week work to make sure that we're safe and getting tested, and that we're putting all the protocols in place for the university's success and the success of our students. So from all of us, thank you very much for what you do, and we appreciate it, and we're looking forward to the next semester, and we will be successful. So thank you.
Thank you.